Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Today's topic is hotelier or healthcare provider. Dr. Dan, my co host and moderator, how are you doing?
I'm doing great, Faisal. How are you?
I'm thrilled. I'm so thrilled about having our guests on today who have done incredible things to show how you can provide primary care, provide all the essential care that people need to improve their health. And they're not doctors. So it's just incredible. So without any further ado, let's have the team from Rosen Health come on. Mr. Rosen, Kenneth, and Ashely, welcome so much.
Good to be
Happy
here.
to be here.
Thank you for having us.
I wanted to know what started you on the path to solve your company's healthcare problems outside of just healthcare policy? Why not trust the politicians?
Well, is it okay if I start?
Absolutely.
I guess it was about 30 years ago, and we were doing things in the traditional way. We had an insurance company, and they handled healthcare for us. Um, we paid our bills on a regular basis. Um, I noticed that the bills were becoming larger and larger as the years progressed. Of course, we were growing, and that might account for some of it. But I thought I would experiment one year and try to focus laser like on our healthcare expenses to see if I could reduce them in some way. So we created some interesting little innovations, and surely, slowly but surely, our costs per individual started to decline. At the end of the year of this experimentation, we had saved some money. My hope was that our savings would be reflected in the new premiums that we were going to be facing. I waited with bated breath for the new premiums. When they came, I was incredibly disappointed. Not only had they not declined, but they had increased rather significantly. I wondered why. And so I attempted to reach the insurance company and was not successful. I finally discovered that they had a regional office not too far from Florida in Georgia. And I called and finally got someone to answer the phone. I asked a very simple question. Why are our premiums increasing when our expenses are declining? And the response I got was really quite startling. It was, oh, it has nothing to do with you, Harris. It has to do with the group that you're in. And I said, what group am I in? I'm an independent hotelier.
That's right.
We're not franchised. We have nobody else that is a part of our little company. So what group? Well, the response was, we put everybody in a group. I said, I don't want to be in a group. I want to be by myself so I can focus laser-like on reducing my costs. He said, well, you don't have that choice. I paused for a second. And then I said, I do have a choice. He said, no, you don't. I said, my choice is to say adios. And he said, goodbye. And now, what was I going to do? No insurance company, no coverage for my associates, all by myself. Well, I did something that was rather bizarre. I decided that we would do everything ourselves. People I spoke to about that thought that I was crazy. But that's not the first, nor has it been the last time that people thought that about me. I was used to that. Interestingly enough, at that very moment, our company was growing, and the office we used for all of our financial associates had to move. We were contemplating moving a small group into that office um, that would accommodate children belonging to families working for us who would be there for daycare. I would be able to take care of approximately 25 youngsters. But now suddenly here I am without health care. And I had this insane idea. What if we, instead of taking care of 25 children representing 25 of our associates, what if I created a little medical clinic in that space, taking care of all of our 700 or 800 associates, plus their dependents?
Wow.
And that's what we did. We hired a primary care physician, a nurse practitioner, an admin, and boom, we had a beautiful little clinic. The doctor, a very, very, very wonderful lady, asked me, what about specialists and what about hospitals? I
Sure.
said, oh, you're right. So maybe I need to create an entity that will do the negotiating for me. And that entity turned out to be our very own insurance company. With my very own insurance company, we were able to negotiate with specialists and hospitals, and we had our primary care facility, and boom, we were in business. I must confess that people thought I was out of my mind. And I did also, but we persevered. The first year went by beautifully. Our associates loved our medical center. We negotiated excellent rates with specialists and the hospital, much better than we were accustomed to. And at the end of the first year, we saved a lot of money. Our cost per covered life had dropped from about $2,000 to $750.
Wow. In the first year?
We actually began to gain some attention. And one of Florida's leading magazines, Florida Trend, heard about our accomplishment, interviewed me and our associates, took a look at our primary care facility, and did a story about us, and actually put me on the cover of the magazine. And that, I must confess, was the beginning of RosenCare and where we are today, 30 years later. So that's how it all started. Not terribly complicated, a bit risky, a little bit crazy. And here we are today with one of the finest healthcare programs, I think, in America. A program that today has saved us, based on our cost per covered life, compared to the average cost per covered life nationwide, about $425, $450 million.
Oh my gosh.
And we have been asked time and again to discuss what RosenCare is all about. We have two experts along with me, Kenneth and Ashely, who can provide you with all of the data that you could possibly ever want.